So welcome to our graduate diploma program. This is called 10905 NAT. It is a graduate diploma of digital orthodontic treatments. Now, it is the college that awards this diploma in Australia is Digital Orthodontic College, which is a subsidiary of the company Boss. So Boss has existed for over 6-7 years now, and Digital Orthodontic College is its trading name. Eventually, we're going to transition to the website calling Digital Orthodontic College. And we're very proud to say we're not only UK accredited, but finally Australian accredited after years of persistence. So we're a nationally recognized training center. We are an RTO as well, which is equivalent to TAFE. So it's like Boss has attained the status of a TAFE in Australia. And it is called Digital Orthodontic College now. So what courses it can provide is for dental practitioners. The only one course that we're providing at the moment is the graduate diploma of digital orthodontic treatments. So I know more of you have joined us. Welcome, guys. Please remember, keep chatting away. I will listen to your chats. Can somebody just chat to tell me that they're hearing me okay? Just somebody say, yes, you can hear me. Everything is clear. Okay, perfect. Thank you, thank you, thank you. So I know. Right. So Boss has had a long history, okay? So actually, I would say short history, sorry, not a long history, short history. We started as a CPD course that literally would have 5 or 10 dentists attending every now and then. It was mostly for my referring dentist. When I started my practice and I became an orthodontist in Sydney, I actually started this study group. And the study group was really because I was very upset with some of the teachings out there. I had just graduated as an orthodontist. I had practiced orthodontics as a dentist for about 9 years. I had done several courses that many of you are still doing or have done with some of the, said gurus out there. So I have kind of been there where you guys are for 9 years before, specializing. So once I specialized, I would help a lot of my colleagues and friends, and I realized a lot of gaps. And I started to do short little lectures that ended up becoming CPD short courses to now an accredited qualification that has about 100 to 200 students enrolled every year for the UK diploma. So Australia is the first time we're running, but it's like an extension of the UK program. We've got a lot in the UK. Just a little happy family, past graduates, some of them. We've graduated over 100 people so far in 2 or 3 years from the UK diploma. But this is just a little, when they receive a little trophy from us and the certificate, and they're just really happy to share that on their social media. So, and because of them today where we are, because of the feedback, because of what they learned, how they helped us grow, is how we know what we deliver best and what to do better. Just a little bit about me, just in case some of you don't know who I am a specialist orthodontist. I finished my BDS from Sydney in 2001, so I've been around 20 years in the industry. I've done a Master's of Science in medicine, that is clinical epidemiology. So I'm very into publications, research. I can do my own biostatistics. I've also then done my specialization of orthodontics from Adelaide. And finally, about a couple of years ago, I did MBA actually. So, I found MBA very interesting, and it's something that I always wanted to do. So I did it online, 100% online. And I did, delivered it really well. So that gave me the confidence to take Boss online. Since then, I've also just attained the certificate for in training and assessment. That certificate accredits me as a trainer in Australia for orthodontics. So I'm a qualified trainer now and accredited. And then, there's a little bit of awards that I won and lots of publications that I published over the years. They're all on the Boss page that belongs to my name. And I think some of it's on the brochure and my LinkedIn profile. But the most recent article that I just published in the top journal in orthodontics is the American Journal of Orthodontics. is the outcomes of clear aligner treatment with and without dental monitoring. So I'm such a big proponent of clear aligner treatment over fixed appliances, and I'll go over it why by the end of this presentation. You will know, because we're going to go through some cases today. We're going to go through some clinical tips, then we're going to get into the course a bit more towards the end. And you know, this study really showed me why virtual monitoring of clear aligner treatments is just so amazing, and how much it helps us. I've written a lot of, you know, short clinical articles like that helps you just, you know, give you little tidbits on how to become a great clear aligner doctor. I'm very impressed by incorporating any kind of virtual technology, 3D printers. I'm doing a lot of in-house aligners now, stuff like that. So anything that helps us see better, diagnose better, treat better, I adopt it wholeheartedly. And, you know, again, I've written another article here. If you want these articles, Dental Monitoring Company actually supplies them for you. They're often included in your welcome pack. And just recently, I've just finished a draft version of this book. It is a clinical handbook of digital orthodontics. And this book is literally like a Bible of the clinical workflow. This is an easy read, meant for your team, meant for you. This is part of the diploma. When you do enroll, you get this book. It's an ebook. It's not downloadable. The ebook is given to you complimentary as part of the diploma, and it's full of templates, letters, protocols, clinical protocols, administrative protocols, you know, simple little things that you may not think about how to troubleshoot when you have your first aligner check, when you have your finished treatment, what are the things to look for. So not only it makes you a better clinician, it also helps your team set up and give you all the right tools around you. So it's almost like a practice workflow guide for digital technology, okay? And it starts from the new patient inquiry and how to deal with that virtually. We do virtual consultations. We you know, online people can submit their photographs. So even before they come in, they've already received so much information. And we don't believe just bringing people in without actually nurturing them a little bit. So this is just a handbook that helps you. Also, one key takeaway from this is, if you want, go subscribe to our YouTube channel. It's full of little cases, educational tips, coaching, little segments of my lectures that I do. So, you know, I think if you're really interested, just subscribe to it and just keep an eye on every time we're putting through some new stuff. So let's have a pause now. And I'm going to talk about my why. Why do I love clear aligners so much over fixed appliances? And why do I do this? So before I go into all of this, can I just have you guys chatting a bit? Can everybody write something here? I'd like to see if you're doing orthodontics. Some of you are, some of you are not. You're complete beginners. What is your biggest challenge? What is your biggest challenge in everyday clinical practice? You can just write short for me, whatever, you know, I'm going to give you about 2 or 3 minutes, guys. So if you don't mind, just type away. What is your biggest challenge when you're practicing orthodontics? Workflow, okay, with orthodontic treatment, case finishing, round tripping. I want to know what I'm doing. So this sounds like confidence, troubleshooting. Okay, that's more skill and competence. Confidence, planning. So planning is all about knowledge, actually. A lot of knowledge is required for planning. Okay, Arun Tari wants knowledge. Treatment planning. Okay. Right. So from what I'm hearing is many of you, it's the knowledge. Knowledge is often confidence, right? The more knowledge you have, the more confident you become. Case selection, okay, that gets to skill and experience. Treatment planning is more skill. It is more experience and skill. modify ClinCheck with confidence and knowledge to get better outcome. Okay, so what I'm hearing is you're all kind of giving me some very similar themes. When I asked what is the biggest challenge, you're saying it's confidence, and some of you are saying it's competence. So it's knowledge and skill. Okay, two things is really what you're coming up with, which is really what an educational course like a diploma is designed to do. You must have both knowledge and skill covered to improve both for a dental practitioner or even an orthodontist. So let's just get into my why. When I graduated from orthodontics, I literally started my practice completely 100% aligners. Actually, I take that back, sorry, 90% aligners. I still had to do some fixed appliances. Now I literally refuse if they say I want braces, unless it's non-compliant patient and I've had to transition. Other than that, we just literally do not take braces patients on, no transfers, we're just clear aligner only. So why did I do that? I mean, I trained in my residency in orthodontics, having done hundreds of fixed appliance cases. I'd only done one clear aligner case, okay? Well, I think there was a lot of factors. I had worked with orthodontists while I was studying. I would go to a lot of conferences. I would meet a lot of practitioners. And I started to realize there was a lot of technologies out there, and our universities are so behind. They're so behind in teaching this. They teach you principles and fundamentals, but somehow they lag behind in the private world. So a lot of patients of ours, times have changed. We're millennials. I mean, COVID is very different to pre-COVID. People were migrating, moving a lot, people living interstate. They have things have really changed now drastically, but patients really didn't have the time to be seen. I mean, now it's very different. And was that a benefit? I mean, having patients not be there physically for their appointment, is that a benefit? Actually, patients prefer it. There's a paper that shows when patients weren't called and they were just assessed virtually during orthodontic treatment, they found that more convenient, and the reduced number of appointments is seen as a benefit. So Australian patients actually prefer this. But also, to me, safety is very important. We're in a very litigious world at the moment, and even me at the specialist level, I have to be very, very careful of how I do things. Our consent has to be really good. We have to really protect ourselves from medical legal issues, right? So I believe clear aligner gives us that tool very easily, okay? And I'll show you why. Well, here's the biggest thing. Any dental practitioner doing dental treatment, and let's look at point number 2, right? Point number 2 is very clearly outlined by APRA in scope of practice guidelines. Any dental practitioner must only perform dental treatment, A, for which they have been educated and trained, and B, in which they're competent, okay? So they have the skill, they have the knowledge. And where should they have been trained in? If you actually go look at the real guideline, there's a footnote that says in a nationally recognized training program. Okay, it goes on to say further things, but at bottom line, they're saying that you should have been trained in a nationally accredited training program. Now, I believe that, when we do treatments beyond our scope, even if we've done CPD, we are entering into a gray area if we haven't been trained and educated properly in that area. Now, when you look at clear aligner techniques and digital orthodontics, it's so new. It is such an emerging thing. I mean, even postgrad residents are being taught much of that by the time they graduate. So, how do we get people equipped? I mean, education has changed. We no longer can go that easily to a 3-year full-time degree and give up our lives. So how can we elevate the knowledge and skill of a dental practitioner and give them the safety behind them to know that they are performing the treatments within their scope, okay? And that they've been educated correctly with a nationally accredited program, and they feel they're competent in delivering it. So BOSS, or the Australian accredited program, is heavily geared at that point too. We try to make sure that the A and B is met for you, okay? And actually, when you look at it, patients do feel, again, using technologies, when you're monitoring them virtually, when you're connecting with them a lot, using remote monitoring apps, they feel this better communication with the orthodontist. So the more communication we have with these technologies, the more we protect ourselves medical legally. Also, it is also a little bit about us. How about, we can buy back some time and can run some treatments virtually. And that is possible. If we are doing clear aligner treatments, nowadays we can do monitoring with apps. So we reduce chair time. Are treatment outcomes affected? And I actually did a paper this was the one that was published in the American Journal, and we presented it as a poster. I think it was at the AAO annual session. This was done with the team in Dubai. And we found actually when we combine technologies like that, recent modern technologies, not only we reduce number of appointments, we also reduce refinements slightly. So case revisions were a bit less. So perhaps we're getting a bit more predictable, okay? Now, again, I've been doing teen aligners from 2011, 10 years in teen aligner experience. Okay, my very first teen aligner case was in 2011. And now I literally do not do braces for children at all. This is a mixed dentition child. He's got his Invisalign. You can see some attachments there. And he's taking a remote virtual appointment for us. So he's got these calibrated retractors via a technology called dental monitoring, and he's uploading a video for us so we can view his occlusion and the changes in his bite as he's going along. Okay, what this app does is called dental monitoring. Some of you may not know. It actually shows us a before and after video, and patients are really amazed at seeing these kind of changes for them. So what I call this type of orthodontics, clear aligners, digital orthodontics, is AI driven. Nowadays, we have a lot of systems to help guide us. Another reason why I established BOSS against many, many difficulties is because I'm very enlightened when I teach. Teaching is it's my passion. Okay, so this is just a photo of me. I've always loved sharing knowledge, teaching. Nothing's off limits with me. There's no secrets with me. And here I'm just teaching my little brother different vegetables and fruits. I've taught, I grew up in India. I used to have, homeless kids come to my home, and I would teach them how to read or write when I used to go to school. So I've always loved teaching, and it brings me a lot of joy. And that's another reason that I do what I do, and that I've, gotten to this point from CPD to a nationally accredited training program. Now that you understand a little bit of what I do and why I do it, I want to show you a couple of just short snippets of cases done by past graduates. So this is by Dr. Anam. She's a 2019 UK diploma graduate. This is a teen case with increased overjet, class 2, narrow arches, and you can kind of see she's achieved class 1 here. She just sent me these photos to say, thank you for your help. You taught me a lot. She was a complete beginner, and now being able to treat, and she used to be in the country, no access to an orthodontist. So just to be able to treat aligner cases, class 2 deep bite, and correcting it to class 1, she was very happy. This is another case, just a mild anterior crossbite in a teen. Dr. Luca, who's also one of our graduates, actually finished this case. When he showed me this case, he finished it in 9 months. It is a simple crowding case, but I can tell you, those of you who've done braces courses, maybe you could get this in 9 months, but look at the finish. Okay, it's a beautiful finish. In fact, a lot of my braces patients, I will convert them to aligners to do finishing. Finishing with aligners is just really, I believe, precision and really, really nice. It doesn't have the same side effects as fixed appliances. So Dr. Luca shared this case with me, and I thought, oh, very beautifully finished. Can you send me some photos? And he did apologize. He said, my initial photo is not that good, but when I did the course, my photos got better, my camera got better. So that's another thing I teach you, is to take excellent records. Record taking is very important. This is a case treated by me. It was a case of ectopic canine in an adult. You can see a huge midline shift pre-treatment. And we use distalization and class 2 technique to erupt the canine, and fix the midlines. So, this is a type of case that I think some of the more advanced, the more knowledge you gain, you should be able to do as well. But now I'm just going to go a little bit into cases because I think cases are fun, and some of my cases that have been treated by me. So I have this case here. His little boy's name's Angus, and he actually had a class 2 deep 2 severe deep bite and traumatic deep bite to the point his incisors had significant wear already at the age of 12. So we decided to not only give him clear aligners, but also give him remote monitoring. And when we were giving him clear aligners, what I realized is we had literally no emergencies. Look at his oral hygiene, look at his gingival health. You can already see that it was much worse initial, and actually it got better as his teeth straightened and he wore aligners. So it was a dream to treat him, and it's the speed in which he finished. He finished in about 15 to 16 months with a severe deep bite, traumatic deep bite, a class 2 occlusion, and moderate to severe crowding. Okay, so he had all permanent dentition. He's just peaking pubertal growth spurt. The timing was right. You can see on the cephalometric, he does have a bit of an overjet. Airway is a bit constricted as well. This is his OPG. The 7s are just erupting. So we believe, and I mean, I teach you growth analysis as part of the course, but we believe that he's going through pubertal growth spurt. This is the right timing. This is his very first Invisalign treatment simulation where we're correcting deep bite. The first intention was to get the deep bite corrected. Vertical is very important to control first. And as the deep bite's getting corrected, we're also doing some expansion and class 2 correction. So this is from the side. You can see he's quite a class 2. And then we are actually using elastics. So the kid wore elastics the whole time with his aligners. Again, this is a case that you should be able to treat by the end of the course. A class 2 deep bite, growing child, it should be a dream for you to treat with clear aligners. No emergencies, very efficient treatment if the kid wears it. Again, from the side view, you can see again how we're first correcting the div 2 incisors to div 1, then we're correcting his class 2. In this lecture, I'm not going to go into detail about what elastic I use, how I correct it, otherwise we'd be here 5 hours. So, but I want you to show the concepts of what you can learn, okay? Now, this is an Invisalign case, but you can use any aligner system. Boss is not specific to Invisalign. You can use Angel Align, Show Smile, and nowadays Spark is coming out for dentists very soon. So whatever aligner system you want, I can work, except ClearCorrect. For now, ClearCorrect is at very, very rudimentary stages. It hasn't caught up with the rest of the aligners in the world, and it's the most behind system at the moment. So unless they change their system, you're going to find it hard to work with ClearCorrect and get these results, okay? So the key to deep bite correction is, do you intrude the anteriors? Do you extrude the posteriors? How do you correct the deep bite? In this case, because he's a growing child, we did both. We intruded his anteriors and we extruded his posteriors to get us that deep bite correction. And you can see in 6 months, he's looking really good. In 6 months, his deep bite's corrected, midlines are coincident. He's almost class 1, okay? This is 6 months in treatment, no emergencies, good oral hygiene, aligner therapy. To 11 months in treatment, he's pretty much finished. And I actually should have finished him that day, but I just thought, I think we're going too fast. Let's just give it another few months and tidy up a bit more. So we did a revision, but this is 11 months in treatment already. Everything is looking good. I can get measurements using certain technologies of how fast his teeth are moving. So this is dental monitoring, the virtual technology. The kid was taking virtual scans every week and uploading them with his smartphone. And we could now measure how fast his teeth were moving. Without taking an x-ray, we can actually superimpose each photograph and work out how much each tooth moves. So for example, his canine had distalized by nearly 1.86 millimeter and extruded by nearly a millimeter. So we can measure these changes just from these photographs from an app, okay? So this is part of all my treatments. This is really what I teach you. I teach you how to do aligners, how to make them predictable and efficient with virtual technologies. I teach you principles. You don't have to go start using everything, but if you do during the course, you will learn a lot. So this is his changes in about 15, 16 months. And now I know a lot of people ask the question, I have a frequently asked question from you all, can I treat some early treatment cases with aligners? And I wanted to share this because I think you're much better off treating an early treatment with aligners. They're very compliant. I mean, kids wear bulky twin blocks. So why wouldn't they wear a thin little aligner that is more comfortable? So this is a girl who came to me with quite severe mandibular retrognathia, but also a lip trap. So her lower lip was trapped behind her upper arch. And we decided to do aligners for her as well as class 2 elastics. So she had narrow arches as well. You can just see her lip really behind. Now, if we don't treat this abnormal soft tissue habit early on, she's only 8.5, 9. If we don't treat it, I think we are actually making her growth, her normal growth and development of her jaws much worse. And there's a potential that her class 2 will never correct, if anything, become worse. So an abnormal soft tissue habit must be treated as early as possible. You can see in her x-rays here, the increased overjet actually was almost 10 millimeters. We decided to do an expander, which in hindsight, I wouldn't do again. You can see the day maxillary expander came off. She's got a bit of gingival bleeding. We got a little bit of arch expansion, but she didn't tolerate it well. I mean, look at her lower lip. It's so behind. It's trapped in that big overjet. And really, she needs mandibular advancement. So there's about 100 appliances I can think of that advance the lower jaw in a growing child. Aligner and class 2 elastic is one of them. So I decided to use the simplest tool that I had, which is an aligner. So for this girl, we went into Invisalign and we decided to do some expansion of her dental arches. And while we were doing that in mixed dentition, we also started to correct her deep bite. The deep bite wasn't really my biggest objective. It was to remove the soft tissue habit, okay? So here's the big overjet that you see. And because of this massive overjet, you can tell why her lip was getting trapped. So our intention is to remove this overjet. Now in a growing child, we have some mandibular growth and we have the opportunity of stimulating it. Whether it happens or not, that's another lecture on growth, but we must try. So again, we used a bit of extrusion mechanics. So the red means those teeth were extruded. Blue means the anteriors were intruded. We use a combination of intrusion, extrusion to correct the deep bite. This is her 12 months in treatment. Her overjet is gone. Her lip is now more balanced. You can see that because there is no trap, her lip is actually quite good. And now she can resume her natural growth and development. We just did an interceptive phase of orthodontic treatment. And when she's older and she has all her permanent dentition, we may need another second phase of treatment. But her second phase should not be as bad as her first phase, right? So this is the changes. That was her overjet before. That's her overjet at the end of treatment. And if I superimpose, you can kind of see her lower jaw here. It just comes a bit forward, doesn't it? It has kind of come a bit forward. Her teeth have shifted a bit back as well. So it was a combination of dental changes as well as skeletal changes that helped to change her facial structure and balance. And now I just want to make sure I have a little pause. I want to show another case. People are asking a lot of questions here. You will hear about BOSS, okay? We will talk about the course, but we have a lot of students who have never understood this. So I know we've got some BOSS current students. So let's let me pause and answer some questions here. What side effects of fixed appliances for finishing? Great question, Angela. This is not a lecture. I'm going to discuss fixed appliances in detail, but fixed appliance is a continuous arch system. If you use a continuous arch system, you're going to create side effects the moment you put a bend in a wire somewhere. Aligners are a little bit different. They're shape-driven system. So you can hold a tooth in one position. The plastic doesn't change shape as you move the other one. Okay, it's a very different system. Hence, I think it has less side effects for finishing. How is the compliance with kids and teens? Priya, I get asked that question every time. Now I'm going to ask you back. How is the compliance with twin blocks? If we're ready to give them big, bulky twin blocks and they wear it, then why should it be different? And actually, all the papers show compliance is not dependent on any factor but the doctor-patient relationship. If you get the patient on board, you motivate the patient, and you have the right manner to do it, you will actually get a very high compliance. So compliance is not really a huge problem in our practice for kids and teens. Do you find difficulty? Again, same question. What strategies would you for compliance? It is the doctor-patient relationship. This is a lecture that I go through in the diploma. Okay, compliance is really driven by doctor-patient relationship, not socioeconomic status. No studies ever found that poorer kids are less compliant than richer kids. Education level, none of that matters. What matters is how you talk to the patients, their parents, how you engage them, and how you get that compliance from day one. Okay, so it's all about consent. Will we know how to trace LATSEV? Good question. No, it's not something I teach you, and that is because I don't believe in tracing LATSEV. I don't think there are papers now that show it's not actually required for majority of orthodontic treatments. In fact, it can be quite erroneous. And if you're going to rely so much on tracing steps, you're going to make a lot of mistakes. So it's a very old way of doing things. This is a newer way of doing things that I'm going to teach you, more evidence-based and newer. Okay. So now I'm going to just get into another case of mine. I'm just going to see how I'm going for time, guys. We still have a bit of time, so let me just go through another couple of cases to highlight to you how this aligner therapy, way better than fixed appliances, especially when you combine the virtual tracking. So part of the diploma, you are going to learn all of this. Everything I'm showing you right now, you're going to learn, okay? So we have a patient here who was traveling a lot back and forth between Australia and UK pre-COVID. She needed something that would suit her lifestyle. I could monitor her from overseas, and I was concerned about her gingival health. So, you know, her recession, for example, she was a difficult case, and how we're going to monitor that. So we used aligners as well as virtual monitoring. She took these kind of videos every week and she uploaded them via the dental monitoring app. We decided to do aligner therapy for her. This is her initial presenting condition. You can see she's an open bite. She's got almost severe crowding, moderate to severe crowding, quite protrusive as well. And she didn't want surgery, so we decided on doing a compromise treatment, which was 4 premolar extraction as well as aligners. Okay. So you can see impacted third molars, which also she has to get removed. And usually we do it at the end of treatment. So you look at her simulation that I've set up. She's got an open bite. We're doing some expansion, some dental arch expansion. What you'll see in a sec from the side, we extracted her premolars. And then we're basically extruding her anteriors to close the open bite. Okay. And here, if you see again, right, you can see the premolars extracted. We're retracting her incisors into that premolar space. A little bit of retraction of anteriors, a little bit of mesialization of posteriors. And we're closing that open bite. Blue is where the teeth were, white is where they're going to. And you see her here in 5 months in treatment. You can see the open bite is closing. You can see the premolars extracted. And what's really nice about this, if anyone who's done a bit of ortho here will notice, none of the teeth have tilted. They're literally moving. It's almost like they're walking bodily across the arch into the extraction space. There's been no tilting of any of the teeth, okay? And because each aligner is being tracked virtually and she's wearing them as much as we want her to wear each aligner. Again, This is something that you get taught in the course. Again, you see here, there's no dumping. Look at the premolars walking back beautifully without any loss of anchorage, without any tipping or side effects, okay? So just with the liners, and she comes from the UK. We decide we're going to continue the correction. Her anteriors weren't leveled, so I wanted to get them leveled vertically, you know, because symmetrical smile is what they're really after at the end of the day. And so I've put, you know, we're not going to discuss here attachments, everything else, but basically we got her to this level. Okay, this was from her virtual appointment in the UK. She submitted her scan, and this was about, I think, I can't remember, 18 months in treatment or something like that. You can see extraction spaces completely closed. Okay, and look at the gingival health. There's no recession. That's increased beyond what was their initial. Open bites closed. So she took 30 months to finish. That's a finish, 30 months, okay? But it's quite a nice finish. If anything, her smile's more even, more attractive. Even though she has a bit of gingival display, it's symmetrical. She's still a bit protrusive, but she didn't want surgery, so we can't do everything. And even though we extracted, you know, lip is something that is, you can't say that 1:1. If you retract an incisor 1 millimeter, it doesn't mean the lip will move 1 millimeter. Okay, everyone's lip tonicity and thickness is very different. So you've got 30 months in treatment, finish 4 premolar extraction cases. Now in BOSS, you do learn to diagnose, you do learn to understand the challenges with extraction cases. Some of the advanced student can also get mentoring from me. I have mentored extraction cases in the past, but these are difficult cases. So they're not something I'm going to teach you from day one, okay? There's something that I see your level, because there's a lot of one-on-one connection with you and I as part of the Australian diploma. If I think you're good enough, I will help you. Okay, so now I'm going to show you another case. The very last case before we go into the specifics of our diploma is a lower impacted canine in a 16-year-old where we have to get an exposure, and we did aligners. Okay, so we did all the traction, extrusion, everything of that impacted canine with aligners. So this is the girl. She presents at the age of 16, and you know, overall she's pretty good. She's class 1. Everything's, you know, it's not bad, but obviously her midlines are severely shifted. Her lower is severely shifted because she probably had an early loss of C, and that lower right canine just lost space for eruption. Okay, so because of that, you know, and it took nearly 16 years for her to get a referral and come and see me. And I wish she had come earlier. So she's got an impacted 4-3. And when we see an impacted canine, we want to know its position. So we take an OPG, and we can pretty much, this one, I didn't even need a cone beam CT because I could see very clearly it's very vertically impacted. It's literally close to the occlusal surface. The only reason I think it didn't erupt is lack of space. So if we could create the space for it, and it could spontaneously erupt, and if it doesn't, we can get it exposed and have orthodontic traction to extrude it. So we decided to start her Invisalign treatment, and the first part of her Invisalign was to expand and create space for that lower canine before we went into exposure. So very simple case actually at this point. We are just using some elastics to move her midlines over, and you will learn how to use elastics as part of the course as well. We use a combination of IPR, expansion, elastics, because it's significantly shifted the lower midline. We do have to unravel it back and gain some space. So we had to even do some interproximal reduction for her to gain that space. And the first strategy is just create space, okay? So you can see from the side, we're maintaining her incisor angulations, but the lower incisors do look a bit dumped back, so we're bringing them forwards. This is 6 months in treatment. We're getting a bit of a nice space for that lower right canine. Her midlines are looking even now. They were very shifted before. And we're kind of looking at doing a revision now. This is a time where we go, okay, let's get an exposure, okay, because it hasn't erupted. Let's go see the periodontist. So I won't go into these deep instructions, but the whole time she was wearing an aligner with a pontic, like a fake tooth, and you can paint that. So, so again, we're just getting this ready for exposure by the periodontist, and she comes in, okay, she's got 8 months of treatment. Now she's got enough space for the 4-3. Dr. Ehsan, who's an excellent periodontist in North Shore, I work with him a lot, does the exposure for us. I like open exposure so I can see the tooth. And you know, this was a very deep exposure. It was actually, I think it got infected a couple of times, but he did a good job. And you see 12 months in treatment. So I'm using aligners, plus I decided to put a little lingual arch down the bottom to increase anchorage. So she stopped wearing aligners for a little while in the lower arch, and we are extruding that canine. You see the 4-3 is pretty much through, right? 15 months in treatment, the 4-3 is literally there. Now we just have to derotate it and get it in the right spot. And here we have 4-3, 90-degree rotated. We got to fix it. And we continue treatment. We do more aligners. We use a bit more IPR, a bit more expansion to create the space for that impacted canine. And we continue on. And 17 months in treatment, you can see it's almost there. And finally, this is her very last revision. For those of you who do aligners, don't be afraid of revisions. I do 5-6 revisions, as many as needed, okay? Because you don't stop treatment until it's there. And the patient, most of the patients are very compliant with aligners. They're happy to keep going because, you know, aligners don't really become too much of a drama in many people's lives when it, you know, compared to braces. So here we are, 21 months in treatment, okay, very, very efficient treatment for an impacted canine. 21 months is not even 2 years. This included exposure, it included creating space, extruding that canine, putting a bonded retainer at the end. You can see a bonded retainer lower canine to canine. And we've got the midlines almost coincident, class 1 occlusion. And actually today she came for a retention check. We haven't updated the photos, but you know, 1 year in retention, and it's exactly like this. Her retainers are looking perfect. And we also give not only bonded retainers, but occlusal coverage retainers as well to wear. This is her OPG. And now that she's a bit older, maybe she'll get her third molars assessed by the oral surgeon. So I'm going to just start to wrap up here and get into the course a bit more and answer a lot of your questions. So we have William Prophet. I was very lucky. You know, he died, unfortunately, a couple of years ago. He's a legend. I think he was late 90s. And he wrote Prophet's book, Contemporary Orthodontics, that everybody knows. It's the Bible. And I got to meet him during my orthodontic program in Adelaide. And, you know, I was so happy to just even have a photo with him. And I really want to acknowledge him because he gave us the most important tip that I can leave you with. It's called Prophet's envelope of discrepancy. The amount of times a dentist will ask me, even an orthodontist, it's not just about dentists, can I move this tooth this much? How much can I move these teeth? Can I move something 1 millimeter? Can I move it 2 millimeter? It's crazy how many times I get asked that. So Prophet gave us this envelope of discrepancy. This was a culmination of lots of studies that kind of show the envelope of tooth movement. How much can you move an upper incisor with orthodontics alone? Well, only about 7 millimeters, okay? You can only reduce overjet with orthodontics alone on a general basis, 7 millimeters here, okay? How much can you do if the child's growing and we can do some orthopedics? Well, maybe you could reduce an overjet of up to 12 then. What if we have skeletal anchorage? Maybe that pushes the border a bit more. But if you have an overjet of 15 millimeters, you're looking at surgery. So he gave us these realms, okay, of how much we can move a tooth. How much can we intrude an upper incisor? Well, no more than 2 millimeters. How much can we extrude? No more than 4. Okay, this is in an adult. So the pink zone is growth completed. Yellow zone is when there's still some growth left. So you have these kind of measurements, okay? And it helps us understand how much we can move teeth. Lower incisors are very different. They are in a very thin symphysis bone. Lower incisors are very prone to gingival recession. So we're not supposed to move them too much. So no more than 3 millimeter labial movement, okay, in an adult. In fact, I would even restrict it to 1.5. I would do half of that. You do not want recession in your adult cases. But in a growing child, you could push the boundary a little bit more, even up to 5 mils. And that also depends. These are generalizations. The more lingually inclined your incisor is, the more labially you can move it. And then, Prophet also told us, how much can we move an upper molar? Well, maybe about 2 millimeters buccolingually in an adult. In a child, even up to 4 millimeters buccally. You can do dental arch expansion up to 3-4 millimeters in a child per side, okay? Because there's still a lot of dental alveolar growth. And again, surgery is the answer when it's extreme movements. If you've got to move a molar by 7 millimeter to one side, you're looking at extreme movements like surgery. So this is probably the biggest tip I'm going to leave you with. If you want to even print this out one day, Google it, Prophet's envelope of discrepancy. It is the most common question asked to me all day, every day, conferences everywhere. So guys, I'm going to pause here and go more into the program now, because that's some of you are wanting to know. How much does the course, I'm just going to stop and pause with the question, how much does the course cover maxillary expansion? Well, it's got quite a few lectures on it. It's quite in depth on it, okay, because expansion is a very important part of many treatments. Okay, so let me just go, all your questions will be answered in a sec, okay? We're looking at a course that's going to give you 400 hours CPD. So you're not expecting to just learn a few little things, okay? This is a diploma. This is not a CPD course. Ara saying Fotra had a PA lesion. Ara, I'm not aware of that. And she's got no symptoms there. I don't know if that's what you see in PA lesion on OPG. Is this a screening tool? Okay. So let's get to the Australian accredited version. This has taken years in the making, lots of legal battles, okay, but we're here. And I'm going to go over how this program teaches you and what it teaches you, okay? So let me first say, forget about the bonus offer. This is actually always a part of this course. The Australian accredited program is very intensive, more than the UK accredited, and we can talk a bit about in a sec. Okay, just bear with me. There's slides coming that are going to tell you the differences. But you're going to get, this is the most unique part of our course. I don't believe just simply training you, giving you materials and walking away from you. I think the best way of learning is having someone coach you, okay? And this is almost unparalleled by an orthodontist. If you compare, and I've got I know every course out there. If you compare any course that delivers one-on-one training or mentoring by an orthodontist, or even has the ability to deliver it, I think that is a very good course, because it is just almost unparalleled. Nobody gives up their time like that. And I know that. Okay, so you're going to get 3 online 101. Each session is about an hour, 45 minutes to an hour. We do that. Now, I've done that in the past where we've got dentists, we do coaching sessions. So, they show me their photographs they've taken. They prepare their first treatment simulation. And sometimes it's all wrong and I've got to fix it all. And that's okay. But the whole coaching session is about learning. So every coaching session I do is actually recorded. And many of those coaching sessions are then put in your e-learning portal so you can learn from other people's cases. This was a feedback given to us by one of our past students. And they said, why don't we learn from other people's cases? So I said, that's a brilliant idea. So we now have a library of cases, Deep Bite, Class 1, Class 2 teen, treated with different aligner systems, Angel Align, Invisalign, Spark, that you can go into the library if you have a similar case, watch one of the coaching videos I've done in the past, and you get a lot of tips. or how did I treat that case, what attachments I put, the nitty-gritty stuff. Okay, so you're going to get 3 coaching sessions with me. During these sessions, there's some assessments that happen as well, which will be viva, questioning, but you're going to get more information about it. As part of the diploma, you also get the clinical handbook, ebook only, okay, as part of the diploma. And it only just came out. So it's only for current students. One person asked a question, past students, I'm sorry, past students are not able to access it. Eventually, this book might be sold one day. And when we have the sale version, we'll announce it to our past students and you can buy it, okay? But we are looking by end of this year to have it on sale. Okay, but for now, it's only available to our current diploma students. And it's a book of nearly a couple of 100 pages, is full of information. The feedback I've got from the current students who've got access to this is that they're really liking it. It's very clinical. It's all written by me, okay? I also encourage you to go to our YouTube channel to continue your learning. So not only part of the diploma, I say, read the book, you're also got the YouTube, just watch some videos. I believe learning is really enhanced when you watch videos. How many times have you gone to a lecture, sat all day in a lecture, and tell me you probably remember only 1 or 2 things at the end of the day? Most people don't have the ability to retain. So when you're able to do video learning, you're at your own pace, you're able to pause, you're able to reflect, you're able to go back and forth. And I think the learning is a lot better. And that's the feedback we get. So you have an e-learning portal full of videos, and I'm going to explain. Now, frequently asked question I get, what aligner system I recommend? I use a lot of Invisalign, but now I've swapped to Spark. I've used Angel Align. Now I use a lot of SureSmile too. So these are my 4 main systems that I use, but that doesn't mean you have to use them. But you do need one aligner system. I mean, this is a whole course about clear aligners. So it would be a waste of your time if you're going to do a 0 cases during this course, because this course is going to develop your knowledge and skill. And if you don't do patients, you're not going to get the skill. So the easiest to accredit at the moment is Angel Align, from what I understand. You literally can get online accreditation really fast. It's got great features, great plastic, very easy to work with. I'm not going to go into costs of these systems, but I think they're all cheaper than Invisalign. Invisalign is a little bit more difficult because they force general dentists to use the Invisalign Go, which I hate, because Invisalign Go does not let you move the molars. And many times you have to move the molars. You have to do some expansion. You have to correct crossbite. You have to derotate them to create space. So if a system restricts you from achieving a good treatment outcome, I don't think you should use it. So unless you're going to get the full Invisalign software, please don't waste your time with Invisalign Go. SureSmile aligners are a very neat system. People who want to get into 3D printers, making their own aligners in-house for mild cases. Today on YouTube, I just posted a video, and even on Facebook, how to do a SureSmile 3D printed aligner for a mild relapse case. So it's a really interesting video. It's 13 minutes or so. Just go watch it, and it shows you the whole process, okay? Okay, another question we get asked, is there any face-to-face component? Now, pre-COVID, we ran everything blended mode, meaning there was face-to-face components. And unfortunately, with COVID, we've actually not been able to manage that. Major conferences have canceled over and over again, and we never wanted to risk it. So we were already ready for 100% online even before COVID. But the moment COVID hit, we had hundreds of dentist practitioners across the world and orthodontists enrolling in our courses. So we've been running 100% online for over a year and a half, the UK accredited version. And we've had a lot of live events during that. So you have the opportunity to ask questions. You do have face-to-face live event. It's just online mode. You do come one-on-one with me. And you know, additional one-on-one can be purchased as well. If you really want extra one-on-ones, that's fine. But generally, most people don't even use their 3. I tell, you know, use 3, they don't even use it. And there's a lot of, you know, monthly group discussion webinars that are live, and we have an entire cohort comes together and we discuss cases together, and you will share your screen and you will show me your cases and we all comment. So there's a lot of interactions. We have a forum where you're going to ask lots of questions all day. Hey, do I do this case? What do you think? I mean, we've got a lot of past students here who are also interested, and they're here today with us. And, you know, I'm sure they'll vouch for how quickly I answer questions. You know, very rarely it would take me 2 days. I would usually answer within the day. So here's the biggest difference. I know some of you are going, which course should I do, Australian or UK? Look, we have dual accreditation now, but here there are some key differences. You are an Australian doctor, majority of you. So Australian doctors, because of AHPRA and the regulations, I would say you go the Australian version. It's a nationally recognized training in clear aligners, okay? Nationally recognized, accredited by ASQA, awarded by the Digital Orthodontic College, which is a registered training organization now. And it's quality assured, it's heavily audited. You know what we're teaching you. It's had a lot of industry feedback. It's had a lot of past student feedback to develop the course to what it is. It's going to take 12 to 18 months for you to complete the Australian online. I think the smarter ones will get there in 12 months. So if you've had some life difficulties, you might take 18 months. Estimated study time, again, it's an average of 7 to 14 hours. I say 1 hour a day would be enough. I don't think you're going to need more than that. I mean, we're all very smart people. We've all done degrees. This is a diploma. It's very suited for comprehensive training. So you learn a lot of principles of orthodontics, growth principles, early treatment principles, plus you learn clear aligner. It's heavily focused on clear aligner. Okay. It is for Australian residents. I mean, internationals can do it, but it's most beneficial for Australian residents. You're getting one-on-one coaching with it. That's included, mentoring. It's suited for all levels. Because of the one-on-one coaching, I'm able to adapt my feedback to you based on your level. The UK accredited is a little bit shorter. Okay, they're not as heavily audited. I wouldn't say not as heavily audited. They're not as stringent as Australia, okay? We got UK 3 years ago. Australia took 3 years of legal battles. So it's not easy to get an Australian accreditation. In fact, none of my orthodontist competitors are there. And it would take them years to even get this, okay? The UK diploma is a little bit shorter. It's not awarded by us. It's awarded by a private accrediting body called EduQual. It will probably take you 9 to 12 months, a couple of hours a week of your time. So obviously the volume of learning is a lot lower. It's really suited for those busy dental practitioners. Perhaps you already do a lot of aligners and you want a shorter solution. You just want some sort of qualification maybe. And it's, again, still suited from beginners to advanced, okay? So we've been running it for a few years, so we have enough feedback on it. And the biggest difference, as you see here, the Australian is 400 CPD hours at the end of 12 months. This is your definite hours you're going to spend, all right? It's highly recommended for an Australian doctor, dental practitioner. You can get dual accreditation. You can simply apply for one. There's no extra assessments, nothing. There's an extra fee for enrollment into the UK. And so if you want, you can graduate with 2 diplomas, one accredited in UK, one in Australia, without any extra assessments. But if you do the UK, because the volume of learning is low, it's only 100 CPD hours. So it is a bit shorter course, a little bit less comprehensive, more case-based, it's a different type of learning. And if you want to do that, later on upgrade to Australian, I think it's a bit harder because you have to do a lot more assessments. You have to do, again, an increased volume of learning. I'm not sure if the UK is that beneficial for an Australian doctor. We have a Slack channel. That's our private forum. It's an app that we use, and we use it every day for support, for networking, for case discussions. I throw my videos in it all the time, Q&A. We talk all day. We've got close to 200 dental practitioners as part of the community who are active participants right now. And then we have an alumni Slack group. So once you graduate, you moved over to that one where we still continue to talk to you. I have students sending me cases. What do you think I should do? I'll still respond. And, so I stay connected with even the past students. So at the end of the day, Another question I get asked a lot, and I thought I'd put a slide on this, is what's the value for money? I think a lot of you are hesitant. I mean, courses are expensive. Education is always expensive. When I did my MBA, I paid 50,000 for 1 year, okay? 100% online. Now that's the cost of a degree. And of course, you kind of look around and you think, who's the right one for me? I think how I explain this, the value for money, is as part of your assessments, you do have to do 2 cases, okay, where you have to submit in detail orthodontic records, so photographs, x-rays. You have to analyze them. We give you templates. You have to diagnose the cases. You have to treatment plan them, and we give you templates for all of that. We guide you through it all, so don't get too scared about it. And then you're encouraged to continue to treatment. Now, you don't have to treat these cases to get your diploma, but you're encouraged to continue, get an aligner system accredited for you, start the treatment, because until you do the treatment, you don't gain that lifetime knowledge and skill, okay? Sorry, knowledge can be gained theoretically, but you don't gain that skill. So I will encourage you to proceed to treatment. So just by doing a couple of cases, there's your value for money, okay? That's just the first part. Then there's unlimited case discussions that we have with participants in a secure forum. A lot of emphasis on case-based learning. Case-based learning has been shown to be the most superior form of learning for dentistry, and the most retained long-term for dentistry. So, during the course of your course, you probably see at least 100 cases diagnosed and treatment plan, maybe more. And you'll treat some of them in your own practice. Now, if you don't have an active registration, you don't have an active indemnity, this is not the right course for you. We don't take retired practitioners. We don't take people who cannot access. I mean, look, you could do it for knowledge, but you're not going to gain the skill. So the best is that you're able to access an aligner system, have orthodontic patients. So the hallmark that I'm going to teach you is how to understand case complexity. Number one issue I see with beginners is they don't understand that this case is difficult or not. So by the end of the course, and it takes really till the end, some people get excited that they should learn everything in 3 months, but it really takes till the end where you start to understand this is complex for me. So learning your scope is important. How do you treatment plan with digital methods? I mean, I don't really teach traditional anymore, but you will see some comparisons here and there. And risk management is very important to me. How to give a good consent, how to constantly have patients on board, managing all the risks, root resorption, white spot lesions. How do you manage all of that? How do you actually prevent them from happening in the first place? Open bites becoming worse. How do you do that? So what the graduate diploma is, just in a summary, 12 to 18 months leading to an Australian accredited diploma for a dental practitioner in clear aligner. You're getting about 3 cases coached for you if you want, with the one-on-one mentoring. We have monthly live case discussion webinars. So if you have 20 cases, you can throw more cases every month, through the forum. And I know that's the most loved feature of our program. When I ask our current students, what do you love the most? They say, we love the monthly live case discussion webinars. Because you're getting the opportunity to share your cases, discuss in a very secure forum. You have orthodontist-led training as opposed to some courses where there's dentist-led training. You have 24/7 forum, 24/7 e-learning portal, online library access. And on top of that, I forgot to mention, we donate for every student that enrolls, we donate a proportion of the fee to help Smile Train treat a child or repair a cleft lip and palate in a developing country. So far, over hundreds of kids have received a free cleft lip and palate surgery because of BOSS, okay? And hopefully one day we'll get to the 500 mark. You will master clear aligners and digital orthodontics and all the different emerging technologies at your pace, which is nice, with 100% content accessible online 24/7. You're going to learn how to deliver it in a practical way with my clinical handbook, with my coaching. You're going to understand how to use treatment planning and workflows. This is quality assured nationally accredited program. So it's not a CPD anymore. It is beyond that. So perhaps it gives you some sort of medical legal protection, and it's not about protection, it's about knowing your scope. And I think that's really what I'm going to teach. We have a lot of guest lecturers who come, mostly specialists and like periodontists, prosthodontists, sleep apnea specialists. We have pediatrician. We have, a couple of orthodontists from overseas who are like world renowned, have also donated their lectures for my program to the current student. Then you have the alumni support, which is you become part of the alumni forum and we continue to chat. Okay, and you can still be part of some of our webinars in the future without any fee. So what really you learn how to diagnose problems, you learn case-based learning, when to refer to a specialist, because there will be cases you're going to refer. How do you do case-based problem solving in a group? Okay. Risk management, very important to me, and that's what I want to teach you. Justify your treatment based on evidence. It has to be evidence-based to some degree. You need to understand how to critically appraise literature. So read some recent papers and I'll guide you with that. Often I'll throw, this is a nice paper for you to read. Orthodontic treatments, so use of expanders, functional appliances, but more aligner driven type of early treatments is what I teach you. Clear aligners, but multiple systems of clear aligners, okay? This is just a recent review from Dr. Tatiana, who joined our course and finished her diploma recently. It's very kind of her to say, Dr. Vandana goes above and beyond with BOSS. In the platform, we have access to amazing recorded lectures, scientific articles, PDF files with pretty much all the information you can think of. Each class will teach you different important points for you to learn when starting clear aligner journey. As Dr. Vandana keeps saying, there is no cookbook approaches, so she teaches you how to think, how to achieve the outcome you want. And that's really, again, a hallmark of thing. I don't like cookbook approaches. I don't say deep bite, do this, class two, do this, okay? I try to teach you, every patient is an individual. And, we're very proud of the Smile Train partnership. They run a sustainable model where they actually teach local doctors how to do cleft lip and palate surgeries in developing countries. And, we donate wholeheartedly to them as much as I can donate every year, as many students enroll. And we have a pledge for every student, to donate a cleft lip and palate surgery. So it's very important to us we continue that partnership, and thanks to you, we've already funded hundreds of them. So let's look at the 7 main units you're going to learn in this Australian diploma. The UK doesn't have these 7 units as clearly defined. So the UK people do have a lot more volume of learning if they want to upgrade to Australian. So the first thing I'm going to teach you is how to, look at research databases, a very short module, look at evidence-based information, how to, we give you an online library access. You're going to have to do a little project where there's an orthodontic question. You've got to research it and critically appraise an orthodontic paper. The second part is performing orthodontic examinations and record taking. So it's almost like a case going through treatment. The third module is all about diagnosing your orthodontic condition after you've taken the records, and how do you plan the different treatment options. And again, all emphasis on digital orthodontics and clear aligners. The next module is how to evaluate and use different technologies. So 3D tools in your ClinCheck, different portals, softwares for orthodontic treatments. There's a module on early interceptive orthodontics that goes in quite a lot of detail. Every one of you I know has received a participant handbook. If you open that handbook, it is super detailed into every little thing you're going to learn, okay? And I'm not going to take this entire hours to show you that, but actually goes through, even under that module, how many different elements you're going to learn, okay? Then we obviously commence our treatment. So a whole module on starting your treatment, bonding attachments, troubleshooting as treatments go on, monitoring them. And then this is very clinical based module. And then you have the final multidisciplinary approach. So doing some cases with bonding, or doing some cases with implant, uprighting a molar. or if you don't have a case like that, we give you hypothetical questions to assess you. So the first unit is all about evidence-based practice. Okay, it's usually done in the first 1 or 2 months of starting the course. The faster you do it, the more, and all the information is released to you straight up, but it's better to do the first one and go sequentially. But you can go in any order you want. Okay, you can go do the second unit first, but really it's best to go in that order. Then when you're looking at performing orthodontic exam, we're going to really talk about how to undertake orthodontic exam. There's videos showing you how to do records. If you don't have scanners, that's okay. PVS is fine. But we do need photographs of study models, digital models. If you don't have x-ray machines, that's fine. You just get them taken by a radiology. And then you need to diagnose what you've taken, edit them, diagnose them. With clinical examinationist supplement, and there's templates and learning on that. Then you're going to diagnose your orthodontic condition. So it involves the skills to communicate ethically and effectively with patients. So we teach you all about informed consent, teach you all about communication skills, agree on a finalized treatment plans after discussing risk and benefits of all different treatments, okay? So, and how we refine those. Then we evaluate and use the appropriate technologies for the treatment. So what aligner system we're going to use, how we're going to design it, the biomechanics of clear aligner treatment, modifying treatment plans according to evidence. So all of that's taught to you. This is a dental monitoring, virtual monitoring scanner. Again, you don't have to do everything I say. You don't have to have dental monitoring. It's something I teach you, but you don't have to have it. Perform early treatment. As part of your course, you do have to have one child case as part of your assessment, where it's okay not to deliver treatment, but you have to in-depth diagnose and treatment plan them and prepare a PowerPoint for them. So again, we're going to talk about facial growth, optimal timing for orthodontic and denofacial treatment, soft tissue habits, growth of jaws, eruption difficulties, space management, expansion, obviously, commencing and monitoring your digital treatments. So we're going to teach you about delivery of that customized appliance and all that goes around it. So the benefits and limitations of clear aligner technologies, therapies, the related protocols. So this is a more clinical unit. And then you have a multidisciplinary approach. So where, we might show you cases that require oral surgery, restorative dentistry, and what are the different options here, and how do you prepare a specialist referral pathway protocol? What comes first? Should we do perio first? Should we do ortho second? Should we do surgery next? Should we remove eights before ortho? That kind of stuff is what you're going to learn here, okay? And that's your 7 units. So each unit has, assessment tasks. So for example, the first unit's a little bit different. It's very quick. It's a short one. You guys already know some of this stuff, how to go into a database and look at a paper and critically appraise, but we'll still teach you again. But it's just got a short knowledge quiz, like a multiple choice question exam, all online, and a quick assignment, okay? Then you've got a cluster of units. So unit 2 to 7 is clustered. The teaching is clustered and your assessments are clustered throughout the course. So you have to present a couple of cases. This is all in your participant handbook. I really recommend you all open the participant handbook. It's very detailed. We have a little viva during our one-on-one sessions, some observations that I'll make. You just write a critical reflection. Templates will be given to you of past students to show you what's required. You have to maintain a journal or logbook of, all the cases you're seeing, how many conferences you're attending, what kind of journals you're reading about ortho. So a little logbook to show your extended learning, and a final knowledge quiz, which is multiple choice examination question, okay? So how do we deliver all of this training? Via our e-learning portal. We have multiple things we do. So we have one thing like pre-recorded lectures, which is your starter course. So we start you with the basics. Then we go into interactive monthly webinars, which are very case-based learning type of webinars. Then we have an online in-office program. Now, it's not a weekend, but we've recorded. It's like the camera has followed me in my clinic, and every patient's treatment I'm delivering, how I'm doing IPR, what am I doing, when I'm giving consent, it's all being recorded in high definition. So you have the entire online program as if you're in my office, but you're not really there. And then there's a one-on-one coaching, which we say is unparalleled for your cases. Okay, so a combination of this gives you a lot of knowledge and skill. So the starter course, for example, when you just join the portal, you'll find a lot of lectures there, and some of the lectures will be things like what are the orthodontic philosophies out there? You know, what did Engel say? What did Begg say? How do you diagnose dental, skeletal, and facial malocclusions? Orthodontic space analysis, traditional biomechanics, and then we apply it to clear aligner. Okay, so you learn a little bit about fixed here because that's very different to clear aligner biomechanics, and it's very evidence-based. I'm very particular about evidence. Invisalign teen and first, which means early treatments with clear aligners, attachment and elastic protocol with case discussions. So, you know, this is like a lot of times I present these live and I record them. And many people like that environment because they feel like it's almost like they're sitting in the classroom with me. Then we have the interactive webinars, as I said, on a monthly basis. You know, a lot of these, if you miss, everything is recorded, everything's delivered to you. If you have questions, you have access to me one-on-one via a forum channel, just you and me, where you can ask me a question. You watch something, you don't like it, you can ask me a question. In multiple ways. Via your e-learning portal, you can ask me a question. You can ask me a question via the forum that we give you access to. So, you know, again, webinar topics are here. Sometimes I invite other specialists like periodontists to come and just talk to us about them. A lot of times there's more webinars than that because we'll get guests who are coming along, and, you know, so we'll just announce an additional webinar because we've got a periodontist who could really be of value to us for the course. So we add them, and generally we have you know, an endodontist as well, Dr. Mark Johnston, who lectures for us a lot. Dr. Ehsan Melati is the periodontist. Jim Papadopoulos teaches a lot about sleep apnea in children. So we have these guest lecturers who also do additional webinars. Again, every webinar is recorded and it's provided in your e-learning portal. The in-office program is very unique to us. So we used to have students come into my office, but obviously with COVID and maintaining safe distance, this is not possible anymore. It's very difficult. So we've actually taken professional videos of my patients coming into the practice all day. It took us weeks to film this. And then we put those videos on the e-learning portal. And what the videos teach you are things like dental monitoring, how to use it, that app. And there's a digital treatment planning workshop, like how do you use 3D tools and all of that. Then there's online videos of taking orthodontic records, how to do orthodontic examination, how to do start Invisalign procedure, how to communicate to the patient, new patient examination, all recorded in my office that actually you watch a series of them. And I think they're very real. They're very realistic in a private office of an orthodontist, okay? Then you have a whole lot of theoretical lectures that are pre-recorded in high definition, things like cellular biomechanics and anchorage, maxillary expansion, functional appliances. Each lecture could be anywhere from half an hour to 1.5 hours long. Class 2, class 3 treatment methods. So it is, as you can see, it's very comprehensive. Retainer, mini screw, impacted canines, risk management, orthodontic philosophies, orthodontic instruments, facial growth, pediatric sleep disorder breathing, and orthodontics. So multiple areas of learning here again. It's all clustered learning. And as I said, any aligner system I'm happy to work with. ClearCorrect's a lot harder. I think there's a little bit of, repetition of these slides. Let me get to, so your biggest difference is, as I